Her own school experience had been unnerving. She had never fit in as a student. People mistook her direct manner for rudeness, and she rarely corrected them. "Are you a nurse?" one boy asked her. His chest puffed out like a bird. She narrowed her eyes at him. "Why do you think so?" "Because Dr. Rylan called you by your first name." Observant, but wrong. The other children giggled, and the boy looked down. "To you, I'm Dr. Keating. And it appears I'm going to be the one talking today about careers in surgery. Now, how many of you—" "If you're a doctor, why did Dr. Rylan tell you what to do?" another student tentatively asked, her big brown eyes peeking out from underneath her bangs. "Because she's my boss." "Aren't you both doctors?" She scrunched up her nose. "Yes, but she's an attending, and I'm a fellow." Nadia looked around at the children's blank expressions. They were here to learn about surgeons, and it would be Nadia's fault if they left this place as ignorant as when they had arrived. She walked to the whiteboard and picked up a marker. "There's a hierarchy, and—" She stopped. They might not understand complex words. The surgical department in a hospital is like a pyramid. At the top is the head of surgery, the chair. She wrote the word at the top of the board. He or she is a fully trained surgeon who oversees all surgical subspecialties. She drew a few lines branching downward. Below the chair are chiefs in charge of different divisions. "Can anyone give me an example of a surgical specialty?" The children continued to stare at her blankly. They didn't seem to be following at all. Finally, the same boy who had asked if she was a nurse said, "Neurology." Nadia smiled, pleasantly surprised. "Is your mother or father in medicine?" "My aunt is." Nadia nodded. Good guess. She encouraged him, wanting to spare the boy another round of giggling from his classmates. Well, there certainly was such a thing as stupid questions and answers. Putting oneself out there shouldn't be discouraged. But neurology is what's called a medical subspecialty. Its surgical counterpart is neurosurgery. Physicians treat patients with medications, physical therapy, and some non-surgical procedures, but only surgeons can operate on them. She wrote Chief and Neurosurgery on the whiteboard, then added a few more examples. Dr. Rylan is one of these chiefs. Did she tell you what kind of surgeon she is? The children furrowed their brows as if they were solving a complex mathematical equation. She's the chief of cardiothoracic surgery. That's a surgeon who operates on the heart and lungs. Nadia drew a few more branching lines. Under each chief are what we call attending physicians. They've completed their training and are responsible for treating their patients, as well as supervising all treatments given by any doctors in training on their service. The chair and the chiefs are also attending doctors, who take care of patients. They just have administrative duties in addition to their attending role. The children were watching her intently. Some had their mouths open, and others looked as if they had forgotten how to blink. Most of them probably weren't following well, but everyone seemed engaged on some level. Nadia smiled. The task Rylan had foisted upon her wasn't as terrible as she thought it would be. And below the attendings are the fellows like me. We're doing advanced training in a subspecialty. Below fellows are the surgical residents, who are usually still practicing general surgery. She wrote fellow and resident on the board. "You're a fellow?" "Correct. I operate on patients, but there's always an attending in the room with me." She added intern to the board. And you may have heard of interns. They're fresh out of medical school. They're at the bottom of the pyramid, and everyone above them can tell them what to do. "Including us?" one girl asked. Nadia chuckled. Even at this age, power was attractive. "No, sorry." She added students at the very bottom of her diagram. When you're a student, you need to listen to what you're being told. At this remark, some of the children stuck out their lower lips. Nadia could relate. She had little tolerance for the hospital hierarchy. She was smarter than the chair, the chiefs, and all the attendings combined. She had a level of expertise from years of research that surpassed her training level, yet she had to listen to everyone above her in the pyramid. At that moment, Jack reappeared, studying his notes. He had to present a concise narrative of the patient's complaint. Nadia had to judge his presentation, examine the patient herself, and verify the facts presented, simultaneously treating the patient and enhancing Jack's medical knowledge. It was a lot of responsibility, but it had its benefits. Nadia looked at the class and said, "He's just a medical student. You can be in charge of him." The class cheered loudly. Jack looked